I mean, when I think back to my birthing experience, my husband just dropped me off at the hospital and was like, see you later, I'm going to get Dominican takeout.
Was it good? Was it good Dominican
I mean,
takeout?
he seemed to have had a good time with it.
Hello and welcome back to DocTalk, our favorite time of the week where me, talk to a doc. We talk to a doc about the things we know you want to talk to a doc about. We're going to talk about doulas. We get a lot of questions. What is a doula? Why do I need a doula? And so we're going to break it all down for you. I think this will be very exciting for a lot of folks for a lot of different reasons.
Yeah, and actually it's a great learning experience, I think, for physicians as well, because I think we've heard and seen these studies have come out in the past few years suggesting that doulas can actually have a meaningful impact on lowering pregnancy complications. And again, unfortunately in the United States, maternal morbidity and mortality has been climbing over the past 20 years. So how can we affect change in a positive way? So doulas, they provide support across the entire continuum of maternity and far beyond, offering guidance not only through fertility, pregnancy, birth, and postpartum, we're going to hear a little bit more about that in a second, but also through menopause, loss, and even end-of-life care. Doulas are not clinical, but they are non-clinical professionals, and they're required to undergo specialized training and certifications to provide emotional, physical, and informational support.
We're not going to talk about every kind of doula today. We're going to focus really on fertility, pregnancy, postpartum doulas. But I like that you mentioned there are all kinds of doulas.
It's a whole rainbow of doulas.
Yeah, and think of a doula as your support person through these journeys that we're going to talk about. Now we're going to watch a clip.
This is Bethel, and she's a Progyny doula. She's specialized in birthing and postpartum.
I love Bethel's room.
You can pause to interject at any point.
So a birthing doula provides a wide variety of supports. First off, there's just the physical support, providing comfort and measures during labor and delivery, the emotional support of helping a birth parent work through some of the intense parts of a labor. There's also partner support, which is honestly one of my favorite parts of birth doula-ring. And doula-ring is kind of the verb we use for doulas, of the action of being a doula.
I love that.
And partner support is where we help your birth partners show up for you in the different ways that they can provide comfort measures, and also kind of act as a second brain if there are interventions that are being offered by the medical providers. I would talk to my client about how they feel about that particular intervention. Do they want to do that intervention? What would happen if they waited, another set of contractions before they pursue that intervention?
I like that because what she's saying is they're not interfering with what the doctor is recommending, but sometimes doctors are very rushed and maybe not explaining options. And so it's helping the patient, the birthing parent, process.
Right, and also help self-advocate in a more, not forceful, but in a more sort of outspoken manner to look out for their own needs.
And educated. I loved that. I loved Bethel explaining how the birth and postpartum, the actual work. And she talked a lot about comforting, providing physical comfort.
And I also like the fact that she didn't, that she also highlighted the need for partner support if there's a partner involved as well.
Okay, let's watch another clip.
A lot of the times when you're in the hospital, you are having nurses and aides come in, check on you, whenever to do all of your vitals, check on the baby. And sometimes going home, there's just a lot more to deal with. And a postpartum doula can be there to provide you with infant care education. They can guide new parents on how to take care of their newborn, how to guide them with feeding, help them with sleep routines, teach them soothing techniques, how to swaddle.
Especially for brand new parents, I think anyone would benefit. But I love here, a lot of people haven't cared for an infant and they might not understand sleep and feeding.
Yeah, and unfortunately babies do not come with instructions like you would like them to. So there's no manual there. So it's really important, even the transition from your postpartum unit into the car or the cab or however else you're getting home. Do you have the right, do you have a car seat? I didn't realize that, right? And also when you're stressed and sleep deprived, right? Providing that kind of calm voice of reason, I think is super important.
Yeah, and another person there to catch things that aren't normal also, I think that's great.
How to swaddle, assisting with that postpartum healing, helping the birth parent get in and out of bed if they had a particularly hard recovery from a C-section or just a really hard vaginal delivery. cleaning, with preparing meals.
Wait,
Your
I
postpartum
wanna-
doula
Me too.
is asking you questions about your emotional well-being. And they might not be a mental health expert, but they might be really connected to their local network and could
We should say that you shouldn't expect your doula to do the dishes. That might not be what all
Right.
doularing looks like. But I like that this person cleaned.
find you and get you connected with community resources that can help you during this time frame, whether it's a certified lactation consultant with your local La Leche League, other mom groups, library groups. I know for me, one of my favorite experiences was I was the doula for the big brothers and sisters. There to support them while mom could, focus on the baby, and dad could do all the different things around the house. And
It's really like full family support too, which I like.
I really like that, and kind of now wish that I had my own doula all the time.
It's not too late.
Yeah,
You can
right?
get one now.
I mean, when I think back to my birthing experience, my husband just dropped me off at the hospital and was like, "See you later, I'm going to get Dominican takeout."
Was it good? Was it good?
I mean,
Dominican
he
takeout?
seemed to have had a good time with it. All right. Anyways, I digress.
I would help them learn the different ways to take care of their new baby sibling. So there are lots of different ways to use a postpartum doula.
So the physical comfort continue, making sure healing is happening. Also like environmental, and she mentioned too, like connecting to other resources.
Right,
like,
because oftentimes I think new parents
Yeah.
don't know what they should be asking about, or don't know that the problems they're stewing over, or like that they're feeling overwhelmed by,
Yeah.
that there are actually solutions immediately available.
yeah, like lactation consultants, I
Yeah.
think is really important around feeding.
Right, and other community resources too,
Yeah.
including mental health resources. So that's great.
I love that. So there's a lot of good data around doulas, doula data. There's
Doularing.
Doularing. There's especially a lot of state Medicaid programs have implemented doulas to help mitigate bad maternal outcomes. So who would you say, based on that research and based on your knowledge, who do you think could benefit most from doulas?
So the research that's been come to light to date has shown that the demographic or the population, parts of the population who tend to need doula support or could benefit the most include low-income women, so women in the low-income bracket, and women of color, particularly Black and Indigenous women.
And that's partially because those groups of women who are birthing face higher bad outcomes as
Correct.
opposed to their white
Right. I
peers.
think the for Black mothers, morbidity and mortality are 2 to 3 times national averages, and that's tragic, right? And is a systems failure, right?
Nationally.
Right.
Yeah, agreed. And so they might benefit from a doula because the doula is their advocate,
Yep.
helping them understand their options
Yep.
and helping them communicate with a provider who may be potentially treating them differently based on their
Right.
race, right?
I remember hearing, I wish I could remember where the podcast was, but hearing the account of a Black OBGYN who was pregnant and actually decided to get a doula, and how helpful that doula was for her. And this is an OBGYN who knows how pregnancy works behind the scenes and in front of the scenes,
Yeah.
and really benefited from having that advocate with her in her hospital
Yeah.
experience.
I think I like the idea of specific folks who need added support using doulas. I do think everybody would benefit
Agreed.
from a doula for all the reasons we've talked about, but particularly those populations have shown it. A doula-ring, the doula there helps improve those outcomes, and that's really important.
Right.
Yeah. Should we watch another clip from
Let's
Linnea?
watch some more clips.
Okay, another doula. I'm so excited.
Studies show that doula-supported births lead to better outcomes. And some of these outcomes are that there's a 39% decrease in the risk of C-sections.
Yay.
There's a 15% increase in the likelihood of a spontaneous vaginal birth
Nice.
rather than having an induction and then that induction leading to a C-section. There's
So
also a
she's talking about doulas being there help increase vaginal deliveries versus
Right.
C-sections. And C-sections are safe, but it's a major surgery that you have to recover from, and most doctors would recommend vaginal
Right.
births
So
over
C-sections can be
elective.
very, very essential to have a safe delivery in certain medical indications, but there's a significant proportion, and I don't remember the percentage now, of uncomplicated C-sections, meaning state by state variation is wide, from like 8% to 15, 25% in terms of uncomplicated cesarean sections.
Yeah.
So that having a support person like a doula to help you advocate for your needs, to sort of not hit pause in a dangerous emergent scenario during your delivery process, right? But if there is time, sort of say, speak up and say, I know you're really busy, but the pregnancy seems to be going, the delivery process seems to be going smoothly now. Do I really need to be rushing to this next step, or can we take a little more time and reevaluate?
Yep, I love that.
Percent decrease in the use of pain medication, which leads to other outcomes as well. And then overall, there's just a lower rate of preterm birth and low birth weight, especially in Black and low income communities.
Yep. So preterm birth and lower birth weight usually means the baby needs NICU support, which is traumatic for parents, traumatic for babies. Like, you want the baby there.
And costly for whomever is footing the insurance bill for that, right?
Yeah. Research points to the American Journal of Public Health, and they highlight that doula care reduces racial disparities in birth outcomes because we provide that cultural competent care and that continuous support. And then finally, in 2017, there was a study in birth, and they found that Medicaid-covered doula care led to lower preterm birth rates as well. And then there were also lower C-section rates that they had compared to non-doula supported births as well.
Which is great. So the doula in place in these Medicaid programs, as we talked about, showed better outcomes for birthing parents and babies, and I think everyone agrees that's our goal.
Exactly.
A lot of Black women, including myself, I've experienced this as well, report feeling dismissed or ignored in medical settings. And so having a Black doula who just knows, or they're trained in anti-racism and cultural humility, can help bridge that gap. Patients don't know what to do when they're faced in these being dismissed or ignored in the medical setting. And so having someone to say, these are some of the things that you can do, or these are some of the things that you can say, can be very helpful to bridge the gap. Because a lot of times when Black women feel that in the medical setting, they don't want to go back. And so it's important to have that patient still be in continuous care with their medical provider. Because we are a continuous labor support, research shows that continuous support during labor reduces unnecessary interventions. Giving different options and having that continuous support there to say, like, could we try this? Could we wait an hour? Could we get you up? Could we switch your position? These are all the things that continuous support can do to help mitigate having a C-section, which is major surgery. Then finally, that postpartum support. A lot of maternal mortality can happen in the postpartum period when women are at home, when they are discharged from the hospital, and they're having symptoms of preeclampsia, they're having symptoms of high blood pressure, they're having a lot of bleeding, they're having all these complications, and they either think, this might be normal, I shouldn't say anything, or they don't go to the doctor yet. And so doulas can...
I think a lot of people don't understand that what Linnea just said, which is that a lot of the bad outcomes happen after mom and baby are discharged. And so I really like what she's saying here, that the doula helps the birthing parent understand that pain, or that feeling, that sensation is normal or is not normal.
Exactly, and also has them on the alert in terms of when they really need to be outreaching and getting help from their doctor.
Yeah, if there's emergent care needed.
Doulas can provide education on those postpartum warning signs that can help prevent death related to preventable conditions such as preeclampsia or an infection, or even postpartum depression. You don't look well, and so maybe we need to call the doctor. Maybe you need to go to the hospital. And so that extra nudge can be the difference between someone making it and someone not making it.
I think especially if a person has experienced racism in a medical setting, they're less likely to speak up because they will feel that they haven't in their experience been listened to and affirmed. And so having that doula say, no, this is important, it's time to talk to your doctor about your pain or whatever. I think
right, and
important.
also if you're in the throes of postpartum depression, you may not realize that you may not have the wherewithal to know that here's a moment when I actually need medical help.
Yeah.
And so having that doula recognize the symptoms and being on high alert so you can access care is super important, because I think the statistic is something ridiculous, like 80% of maternal deaths can be prevented. And I think having this kind of support system in place goes a long way.
Yep, agreed. We're going to talk about how one might access a doula. So we've convinced you. You know you want a doula to support you on your either your fertility or your pregnancy postpartum journey. So how would you find a doula?
Easy if you have the Progyny benefit in place with the access to our P3 or pregnancy postpartum support, because we have integrated doula services within that program. And so you would just contact your Progyny CE clinical educator on the P3 team, and they would connect you with your doula services.
Yeah, and that would happen automatically even if you don't ask for it.
Right, and then if you're outside of the Progyny system, how do you get it?
Yeah, so if you're outside of the Progyny system and looking for a doula, there are a number of, while there's no national licensure for doulas, there are a number of national like collectives and certification programs. Yeah, so a good one is DONA, D-O-N-A, DONA International. It's one of the largest and most well-known. On their website, you can find a doula, but there are others. Childbirth and Postpartum Professional Association, birthing advocacies and doula trainings, and other like collectives where you can find a doula.
Isn't like Mama Glow one of them too?
I think so. Yeah.
Right, so
yeah. And so I would say go to a larger one that has certification. You can read about how they certify doulas. It usually means they've attended a certain number of live births and supported patients or people. And so I think finding a doula and near you, those would be the easiest ways to do it.
And I think also a lot of the hospitals now, if they lead birthing classes, can also connect you with local doula resources as well.
Yep. Okay. So if you or someone you know is anticipating being pregnant or is pregnant right now, adding a doula to your care team makes total sense. We've already talked about how it improves outcomes, and I think better educated and advocated for people are better patients. And so I'm sure doctors also appreciate in most cases when a doula is there, helping to support birthing parent and partner. Any other thing you would add about doulas?
I would say before you do the closeout, Lissa, is that remember, a doula is a professional support person. They don't replace a doctor or nurse midwife.
They actually deliver the baby.
Right, they don't. They work alongside your medical team to optimize the health care that you're accessing, to keep you safe, to keep you empowered, to help you with your self-advocacy. I think all very important.
Yeah, and everyone's goal is aligned, which is healthy mom, healthy baby, healthy, safe delivery with the least intervention possible. Right? As always, I love doc talking with you.
Me too.
I love doularing too. I love talking about doulas. As we say every week, if you have things you want us to doc talk about, pop them in the chat, and we certainly will. A lot of our topics come from people who said, I want to know more about blah. And so add it. We love doc talking with you. I love doc talking with you.
I love doc talking with you. This is one of the bright spots of each work week. So.
Oh, thanks guys.
Thanks.
Bye.